Good afternoon, all. I'm Adam Myers, co-director of the Health and the Public Interest Program with Adrian Fu Berman, who is also with us this morning. And it's actually going to be our last seminar under the graduate program umbrella. But as I've mentioned many times, we're going to hope to continue this starting in September with a probably monthly seminar throughout most of the year, skipping a couple summer months, I suppose. And we're going to continue the kind of breadth of the subjects that we've had here today. And I welcome any messages from anyone about what you'd like to hear next year in a seminar series in this new format. So feel free to send me a message at myersa@georgetown.edu, which I hope will appear in the chat in a moment. Thanks, Jen. Um, so the speaker today is Jake Beckerman, who's going to be introduced by our moderator, and it's a real pleasure to have him here for seminar today. He's a public health researcher. You'll hear more about him from our moderator, but he's a former Georgetown student who did his honors thesis work in the Department of Physiology back in the day, and I haven't seen him in quite a while, so it's a special pleasure for me. And we may have a couple of his old colleagues here. I see John Partridge is on the call, and I think perhaps Stefano Vicini may be on as well, and perhaps Jose Young if he makes it. So the seminar is going to be about 45 minutes, followed by lots of time for questions and answers. It's going to be moderated by our student moderator who will take questions first from our student audience and then followed by the general audience. We can go as late as 1:15 if that's okay with you, Jake. We usually don't quite go
Yep.
that long. With that, we'll turn it over to for the formal introduction.
Thank you, Dr. Myers. It is a pleasure to introduce Dr. Jake Beckerman-Hsu. He is a public health researcher specializing in the evaluation of federal nutrition assistance programs and the use of quantitative and mixed methods research to inform public policy. His current work focuses on the Supplemental Nutrition Assistance Program, or SNAP, and the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. Dr. Beckerman-Hsu has led multiple large-scale nationally representative studies, including the development of longitudinal WIC participant data, analyses of SNAP benefit changes on household food purchases, and evaluations of algorithmic risk assessment tools for SNAP payment accuracy. He has played key roles in designing federal data collection systems, developing technical guidance for state agencies, and conducting rigorous quantitative, qualitative, and mixed methods analyses. His work has directly informed federal guidance, program modernization efforts, and strategic decision-making. His peer-reviewed research spans nutrition policy, early childhood health, and community-based interventions. He holds a PhD in population health sciences and a Master of Science in biostatistics from the Harvard T.H. Chan School of Public Health, an MPH from UCLA, and a Bachelor's of Science from Georgetown University. And his fun fact is that as a child, his career aspiration was to be an action movie stuntman, but he realized that he would need something more exciting, which is what led him to teaching and then to be a public health researcher. Without further ado, Dr. Beckerman-Hsu, you have the floor.
Thank you so much for that great introduction. It's really quite an honor to be here. I'm going to get my slides going and get us off to the races. All right, so I'm really excited today to share with all of you a bit of my work about predictive analytics and public health. My slides were lagging just a little bit before, but hopefully they pick up soon. There we go. All right, a quick disclaimer before I really get going is I want to say all opinions that expressed here are my own. I'm doing this on my own time. I do work for Westat. If you're not familiar with Westat, we're a private research firm that primarily does research for the federal government, different agencies in the federal government. We have other clients as well. So everything that I'm sharing today is my own opinion, does not reflect those of Westat or of its clients. Here's what I'm hoping everyone listening learns today. By the end of this presentation, I'm hoping that you can explain some of the potential pros and cons of using predictive analytics in public health and public policy. And I hope you also know a bit about how we can evaluate predictive tools to make informed decisions about their use. And I want to open us up with a story about a fight over what's fair. And to do that, I need to introduce you to COMPAS. COMPAS stands for Correctional Offender Management Profiling for Alternative Sanctions. It is a predictive model that uses a wide array of data points to estimate the chance that a criminal defendant commits another crime. It's been adopted by many states and jurisdictions in the US to inform criminal justice decisions like pretrial release and sentencing. And the map that you see on the right is not showing you Compass specifically, but is showing you across the US in the legal system how many decision points are being informed by predictive models. And as you can see, it's quite a lot. So Compass is an example, but it's one of many predictive models that are being used in the legal system, which some of you may be asking then, well, what is predictive modeling? And all it means is any way that you can use data to determine which future event is most likely to occur. That's predictive modeling or predictive analytics. So an example is Compass, right? Using data on criminal history and other factors to assess the likelihood that somebody will commit a crime in the future. And there are two common myths maybe that I want to dispel up front. First of all, there's no requirement for predictive models to be accurate. You might think that in the age of big data and AI, that if somebody says they have a predictive model, it's almost magical. It must be doing amazing things. Um, Maybe, but maybe not. And actually, one of your first questions when you learn about some predictive model is to ask, well, how accurate is it? A second item about predictive models, and I know that it can seem sort of like a foreign or abstract idea, is especially if like, oh, it's some really complicated thing that computers are doing. It can be really complicated, but it doesn't have to be. Predictive algorithms can also be really simple. So I hope that encourages you. Just because it's a predictive model doesn't necessarily mean it's something that you won't be able to understand and engage with. And actually, to make this even more familiar to you, I want to show you or maybe make you aware of the fact that you are probably already familiar with the key concept of predictive modeling because most of you probably have checked out your credit score at some point. And credit scores are exactly prediction analytics, right? It's using history about your credit behavior to predict how likely you will be in the future to pay off a loan on time, things like that. So if you feel comfortable with the idea of credit scores and how they work, you also have a pretty good understanding of what predictive models are doing. All right, so back to Compass. In 2016, ProPublica released a pretty sharp critique of Compass. Uh, they titled the article Machine Bias, and their basic point was that it was racially biased. And the evidence that they presented summarized in this table. So what they did in this article is they analyzed data from Broward County, Florida, which was using the Compass model, and looked at how often was the model making mistakes. And they specifically looked at two different types of mistakes. So a first type of mistake that the model could be making is that it labels somebody as high risk. So the model says this person is likely to commit a crime in the future. But in reality, that person does not go on to reoffend. And they found that for white people, that was 23.5%, but for African Americans, it was 44.9%. They also looked at a different type of mistake that the model could make, which is the model says this person is low risk, not very likely to commit a crime in the future, but they actually do go on to reoffend. For white people, that's 47.7%, and for African Americans, that was 28%. So with both of these types of errors, if African Americans are being labeled higher risk, even though they don't go on to reoffend, and they're also less likely to be labeled low risk, even if they do reoffend. Just overall, this model is saying African American people are higher risk. That probably means that judges and other people in the legal system using this information will be less likely to release them on bail. They might sentence them to longer periods. And this is really the thrust of their argument. First of all, they point out that this Compass tool, at the time the company that owned the tool was called Northpoint, it's only accurate 61% of the time. So, and it gets to what I was saying earlier. Just because it's a predictive model doesn't mean it's some super fancy thing that's really accurate. 39% of the time it's wrong. But not only is it wrong pretty frequently, it seems to be particularly harsh towards African Americans. Well, North Point issued a rebuttal. They put out a report demonstrating the accuracy, equity, and predictive parity of their model. And their findings were really nicely summarized in an article that originally appeared in the Washington Post, and that's the figure that's on the right-hand side of the screen. So in this plot, we're looking at the risk score along the x-axis. So the COMPASS model gives people a risk score of 1 to 10. 1 means they're the lowest risk of committing a crime in the future. 10 means the highest risk. And on the y-axis, we're looking at the chance of recidivism. What proportion of those people actually went on to commit a crime in the future? And what they showed is that, look, the line on this graph for Black people and white people is basically overlapping the whole way. So no matter which risk score you pick, like if you pick a risk score of 9, a Black person with a score of 9 and a white person with a score of 9 were equally likely to go on to commit a crime in the future. And this was the argument from Compass that actually, no, our tool is fine and it's being fair to these two groups of people. Well, ProPublica issued a rebuttal to the rebuttal, which basically said, yeah, we hear you, Compass, but we still think we're right. And when I first saw this, and maybe a lot of you who are seeing this for the first time, you might be thinking they both kind of seem right, though. Like that table from the ProPublica article looked really convincing that there was a big problem. But then the graph seemed to show, no, it looks really similar for Black people and white people. Like what's going on here? And it turns out that they're kind of both right, just in their own way. There are actually a lot of different ways that you can measure how well a predictive model works and whether it works equally well for different types of people. And in most real world scenarios, it is actually impossible for a model to work equally well according to all the commonly used measurements of model performance. And to illustrate that point to you, so you really understand why, I want to talk you through an example with COVID, because that's something that I think all of us are pretty familiar with. We've all taken plenty of COVID tests, probably. And I'm going to spend a decent amount of time walking through this example because this is one of the key things that I'm hoping that you will learn from this lecture is an understanding of how do we evaluate a predictive model to make informed choices about it. All right, so let's say for this COVID example, you have just developed a new AI chatbot COVID test. So people can go to it and describe their symptoms, and then the AI tells them if they have COVID. And you want to see how well it works. So you want to compare the predictions that your model is making against some people who you bring into your lab. So you bring into your lab 100 people who really have COVID, like you've given them the most accurate COVID test and you know that they really have COVID. And you also bring in 100 people who really don't have COVID. And the way that you would organize your results would look like this. This is a table that's called a confusion matrix. It's really commonly used in machine learning and computer science and any fields that do predictive modeling. And it's doing exactly that. It's going to compare the prediction from the chatbot against the truth that we know based on the most accurate current COVID test. So filling in this table would look like this. First, we can fill in the totals for COVID positive and COVID negative. Like we know we brought people into the lab purposefully, 200 total people, 100 with COVID, 100 without COVID. When it comes to the predictions, some people are going to be predicted positive. If they really do have COVID and the chatbot says they have COVID, that is called a true positive. And so I just made up numbers for this example. Let's say there are 96 true positives. You could also end up with false negatives. False negatives are the people who really do have COVID, but the AI chatbot was wrong and predicted that they don't have COVID. Another possible outcome here is false positives. False positive is probably a term that a lot of us are familiar with because of COVID tests, and it's why I picked this COVID example, right? If you get a false positive test result, it means the test says you have the disease when in reality you don't. And that's exactly what this table is showing, right? For the people who really don't have COVID, if the chatbot tells them that they do, that's a false positive. And the last possible outcome here is a true negative. It means they really don't have COVID, and the AI chatbot is correct and says they don't have COVID. So the very last things to fill in this table, you just add down the columns and see in total there are 104 people who are predicted to be positive. The chatbot thinks that they have COVID, and 96 negative. So now that you have this table filled in, there are lots of different things that you can do with these numbers to sort of summarize how well is your model working. One really common one is called it's called sensitivity. It's a pretty, I think, intuitive question to want to ask. It's out of all the people who really do have COVID, how many of them did the chatbot say have COVID? So that's called sensitivity. True positives divided by the total number of real positives. And here we're looking at 96% sensitivity. If a predictive model is going to be fair, I think it makes sense to a lot of us and aligns with our general notions of fairness that it should have the same sensitivity for everyone. If this chatbot had a sensitivity of 96% for men, but only 80% for women, I think a lot of people would say there's a problem with this model. It's not working as well for women. It needs to be fixed somehow. A second performance metric that's pretty common to look at is, well, what about the people who really don't have COVID? For those people, how accurate is the model? So specificity is that measure. It's the true negatives divided by the total real negatives. It's for the people who really don't have COVID, how often are they being told by the model, no, you don't have COVID? So here we get 92%. And similar to sensitivity, for a predictive model to be fair, ideally, it would have the same specificity for everyone. Drawback to sensitivity and specificity is that you can only calculate those numbers if you already know who really has COVID, right? The number of people who really do have COVID or really don't have COVID is the denominator of those percentages. The issue is that if you take a COVID test, in general, you're doing it because you don't know if you have COVID. So often, what the test taker really wants to know is not the sensitivity and specificity. They want to know if I get a positive test result, what's the chance that I really have COVID? And if I get a negative test result, what's the chance I really do not have COVID? To answer those questions, you need to look at a different model performance metric. So positive predictive value is the answer to that first question, right? It takes out of all the people who got a positive test result, they were predicted positive, how many of them really did have COVID? And with these example numbers, we're looking at 92.3% positive predictive value. The answer to that, oh, sorry. And again, to tie this back to the compass example and think about fairness, right? For a predictive model to be fair, I think ideally it should have the same positive predictive value for everyone, right? If for all of the men who get a positive test result, 95% of them really do have COVID, but for women who get a positive test result, only 85% of them really have COVID. It just feels like it feels problematic. It feels like you need to fix that model somehow so it works equally well for men and women. And I got ahead of myself a little bit a second ago. But the answer to the second question, if I get a negative test result, what's the chance that I really do not have COVID? That's called the negative predictive value. It's the total predicted, out of the total predicted negative, how many are true negatives? And here we're looking at 95.8%. You can probably guess what I'm about to say, but again, for fairness and to tie it back to this whole compass debate, it seems like ideally it should have the same negative predictive value for everyone if we want to call this AI chatbot fair. So we've done all this testing in the lab. We brought in, the 100 COVID positive and the 100 COVID negative people. It seems like it's working pretty well. So now let's take it out into the real world. So let's say we go out into a community with 100 COVID positive people and 1,000 COVID negative people. So we do that, and I'm going to show you kind of filling in the new confusion matrix for this community. So in this example, I mean, we set up front, there are 100 COVID positive people and 1,000 COVID negative people for a total population of 1,100 people. From our testing back in the lab, we saw that the sensitivity was 96%. That means out of everyone who really does have, out of all the people who really do have COVID, 96% will get true positives. So since we have 100 people with COVID in this community, we get 96 true positives, 4 false negatives. We also know from our testing in the lab that the specificity of this AI chatbot was 92%, right? Out of all the people who really don't have COVID, 92% will be told by this chatbot, no, you do not have COVID. So just filling in the numbers, we had 80 false positives, 920 true negatives. So the last numbers in the table to fill in are just adding down the columns. We end up with 176 people predicted positive, 924 predicted negative. And a funny thing happens when you bring this chatbot into a different community. So originally in the lab, we had a positive predictive value of 92.3%. Now that we're out in a community, we have a positive predictive value of only 54.5%. So for the people who get a positive test result, I mean, you might as well just flip a coin to decide whether you do have COVID or you don't, right? Only 54.5% of the people who are getting a positive test result actually have COVID. The negative predictive value also changes in this new setting. When we were testing this thing back in the lab, we had 95.8% negative predictive value. Now we're up to 99.6%. So to summarize this and bring this together, in that example I gave you, I talked about testing in the lab versus using this COVID chatbot out in some community in the real world. But what if instead of an original group of people that we're testing with and that new group of people in a different place, we're talking about two different racial groups? When I was introducing you to sensitivity, specificity, positive predictive value, negative predictive value, I was saying that to me at least, it seems like those metrics should be the same for everyone if we want to call the model fair. And hopefully you agree that that's the case. But you just watched a tool with the same exact sensitivity and specificity have a different positive and negative predictive value for different groups of people. And this is kind of the closing up what I said before. It's actually impossible to get a predictive model to have identical sensitivity, specificity, positive predictive value, negative predictive value in most real world situations. And this was summarized really nicely in a paper by Corbett Davies and Goal, and I'll read you the quote here. So Angwin et al., those are the authors from ProPublica, found that the Compass risk assessment tool had a higher false positive rate for Black defendants in Broward County, Florida, and had a higher false negative rate for white defendants. These differences were widely interpreted as indicating that Compass was biased against Black defendants. In response, the developers of Compass argued that false positive and negative rates were flawed measures of fairness. They instead advocated for ensuring equality in positive and negative predictive values across race, which Compass achieved. And just a quick note for you there were false positive rate and false negative rate is just the other side of the same coin from specificity and sensitivity. And so what they're pointing out is that there is essentially an unsolvable tension between these different metrics that assess how well is a model working. And there are good arguments on both sides to say, well, it seems like all of them should be the same to be fair. And how do you pick one over the other when they all seem pretty important to make a model fair? And this kind of brings me to where I found myself pretty recently. I was in a spot in some of my work where I thought predictive models could be really, really helpful. Um, and so the question is like, am I just doomed then to end up in some big argument, maybe with some news organization over what's fair? Um, I don't think that's going to be the case, and I want to try to illustrate to you why. So one of the areas that I focus on in my work is the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. To give you a little bit of background on the program, SNAP helps to provide food for about 42 million Americans each month. It's about 1 in 8 people in this country. Most of those people are children under 18 or adults 60 and up. In order to participate in SNAP, households need to meet income and asset requirements. And so this is a program that serves only low-income households. For those who do qualify and participate in the program, they get benefits, food dollars, that they can take to the grocery store and buy food to prepare and consume at home. So most of the things that you can buy in the grocery store, you can buy with SNAP dollars. It's not everything though. You can't buy hot food. You can't buy non-food items. Like a lot of us, maybe we pick up paper towels or dish soap at the grocery store. You can't buy non-food items with SNAP dollars. But a lot of the, kind of staple foods that you would bring home and eat are things that you can buy with SNAP dollars. And that's what SNAP is providing to about 1 in 8 people in this country every month. The way that benefits are assigned, so like the number of dollars that a household gets, it's based on two key factors. One is their net household income, which is the amount of income that they have left after allowable deductions, and the thrifty food plan. The Thrifty Food Plan is the lowest cost of four USDA food plans for a diet that meets recommendations. And so USDA, the United States Department of Agriculture, actually calculates how much would it cost to purchase all the foods that put together a diet that meets recommendations. And they have different price tiers for that. The lowest cost of those price tiers is the Thrifty Food Plan. And the Thrifty Food Plan cost is the maximum SNAP benefit level. So the way that in the end a household's benefits are determined is households are expected to spend 30% of their net income on food. So if they have $0 in net income, their SNAP benefits will be exactly the price of the Thrifty Food Plan. If they do have some income, some net income, the expectation is they spend 30% of that net income on food. And whatever is the difference between that amount and the cost of the Thrifty Food Plan, they will get that amount in SNAP benefits so that they are able to purchase the lowest cost option for a diet that meets recommendations. Right. The next thing to bring you up to speed on with SNAP, to get to where do the predictive models enter this equation, is to understand a bit about payment accuracy. So part of SNAP is an area called quality control. Quality control is when reviewers assess a random sample of SNAP cases every month. So cases get pulled at random, and a reviewer looks over everything to see basically, is it done right, right? It's like the name sort of implies, the quality control check on the work that's being done for households in SNAP. One of the things that they can identify when they review a case is a payment error. A payment error is any difference between the actual benefit amount that a household is receiving and the correct benefit amount as was determined by the QC reviewer. And there are a few really important things to understand about payment errors. One is that this includes underpayments and overpayments. So if a household was getting less benefits than they were entitled to, or more benefits than they were entitled to, both of those are payment errors. It includes mistakes made by households and by state agencies. And so a household could do everything right. If the state agency makes an honest mistake, maybe they just make a typo or something, that's still a payment error. It's also a payment error if the household makes a typo or forgets something and it ends up leading to a payment error. And this third point about the payment errors that is really important to emphasize, and I think is a really common misconception, this is not a measure of fraud. Payment errors can happen because of, like I was kind of just mentioning, honest mistakes. A typo can lead to a payment error. If I tell the SNAP agency when I'm applying that I have $2,000 a month in income and they accidentally leave off a zero and enter into their system that I have $200 a month, it's going to change my benefit level. So I'm going to get the wrong amount of benefits, and that's going to be a payment error. There are, of course, a lot of systems and checks in place. It's really important to state agencies, and it's a high priority for them to get the benefit amounts right. But honest mistakes happen. They can lead to payment errors, and overall, the payment error rate is not a measure of fraud. Um, but in the end, what all of the kind of the sum of the payment errors that are identified leads up to is a state's payment error rate. Each year, and it operates on federal fiscal years, they calculate an official payment error rate. And it's essentially how many dollars were paid in error, or overpayments or underpayments, out of the total dollars of benefits issued. It's a little bit more complicated than that, and I'm happy to answer any questions that folks have about it. But this is the key concept that is important for you to understand for kind of the sake of this talk. So across the US, the payment error rate varies quite a bit. SNAP is state administered. So each state runs its own SNAP offices. They're responsible for doing applications and recertifications and all of that. There are 53 SNAP state agencies. It's the 50 US states, DC, Guam, and the US Virgin Islands. And so each of them has their payment error rate calculated, and it does range quite a bit. This is the last thing to bring you up to speed on with SNAP, to kind of get to our discussion about predictive modeling. There have been some really big changes to SNAP made under HR 1. HR 1, maybe better known as the Big Beautiful Bill, made a number of changes to SNAP and other programs. But the one that is important for you to know about for the purpose of this talk is the way that its payment error rates are going to be used in the future. In the past, payment error rates have been calculated, but it would not affect how much money the state had to pay for the benefit dollars that were going out to households. In the past, 100% of the benefit dollars were paid by the federal government. But under HR 1, states will have to start covering a percentage of the benefit cost based on their payment error rate, which is pretty nicely summarized in the plot on the left. There's an exception for how it's going to work in fiscal years 28 and 29, but it gives you the general idea that the higher a state's payment error rate, the more money that they're going to have to cover for the cost of all the benefit dollars that go out. As of fiscal year 2024, which is the most recent set of official payment error rates that we have, most states are going to need to pay for part of their benefit costs. This has been a huge issue in SNAP. It's kind of an existential problem. A number of organizations got together to issue a response from governors, a letter to the leaders in the House and Senate. Quote here, the financial implications are significant. Under HR 1, states with a per payment error rate above 6% will be responsible for between 5 to 15% of SNAP benefit costs. Using fiscal year 2024 per data, this represents an average of $218 million per state annually, with impacts ranging from approximately 5.5 million in North Dakota and 37 million in Hawaii to 991 million in Florida and 1.8 billion in California. These sums of money are not amounts that states have in excess every year just sitting on the shelf that they'll easily be able to reallocate to SNAP. This is an enormous challenge in SNAP right now. There are folks all across the country working really hard on this issue to, like I said, payment error rate has always been a priority. There are folks working even harder now and putting even more resources into trying to figure this out because this is a really big challenge for the program. So this is where I think there's some opportunity for predictive modeling. A very oversimplified look at how SNAP households end up getting their benefits is here on the slide. So if you're applying to SNAP or you're recertifying for SNAP, you submit a written application. So it could be in paper, often it's through some kind of online portal, right? You provide a lot of information. You can provide documentation about things like different sources of income that you have. Then you'll have an interview where they'll ask you more about your household situation. They'll verify a lot of the information that you've given them. They'll correct anything or update anything as needed. And then the state agency will make its eligibility and benefits determination. They'll decide yes or no, are you eligible for SNAP? And if you are, how much money and benefits should you be getting? And after that, for those who are eligible, they issue the benefits. The part of this process, or one area of this process where predictive modeling could enter, would look like this. Let's say that after the initial eligibility and benefits determination has been made, but before the benefits actually go out the door, you have a predictive model running in the background to identify the cases that are most likely to have payment errors. For any of the high-risk cases, the ones that are most likely to have payment errors, you could give them an extra review just to make sure they're accurate. In that review process, you might be able to catch some issues and correct them before the benefit dollars go out the door. That would decrease the payment error rate, and that's kind of the name of the game right now is how can we decrease the payment error rate? So in theory, this could be really helpful, but we still have to address this fairness question that was a huge debate when it came to Compass. So if we're thinking about model performance and fairness in SNAP, this is really just me kind of sharing my thoughts about how can we address this debate and this hard issue over like how do we think about what's fair. The first question that I asked to try to find a path through was, all right, first of all, who stands to be helped or harmed by a payment accuracy predictive model? And I think the two parties in play here are the applicants and participants and the SNAP state agencies. So the next question is, well, how would they be helped or harmed by each of the four potential outcomes of the predictive model? Like for a household that's applying, if they get a true positive result from this predictive model, what happens to them? Are they helped by it? Are they hurt by it? For the state agency, if they're getting true negatives, how does that affect them? And so I'll walk you through and show you sort of this thought experiment of thinking through, all right, well, what would happen if different people, different parties who have a stake in this, end up with different types of results? Starting with the applicant and participant perspective, if they get a real negative result, so in reality, they don't have a payment error on their case, I don't think they would really be affected by any kind of predictive model. Right. If they get a false positive result, so despite the fact that there's no payment error on the case, the model thinks that there probably is. What's going to happen is someone at the state agency is going to review their case only to find there was nothing wrong with it, so nothing changes. Like their benefit levels stay the same as they always were. And of course, if it's a true negative, no one would take the time to give that case an extra review because there's not a reason to think that there's a payment error on the case. And so there's no effect on the household. For the true positives, this does make a difference for the household. If it's a true positive, that would mean someone at the state agency is going to give that case an extra review and hopefully in that extra review catch a payment error and actually change the benefit level that that household is going to get before the benefits go out. It could be a change, an increase in benefits because originally it was going to be an underpayment. It could be a decrease in benefits because originally it was going to be an overpayment. Um, Both of those clearly have important effects on the household. To think a little bit more through the implications of both overpayments and underpayments, um, I want to show you false negatives. If it's a false negative, that means there really was a payment error on that case, but the model says, no, there probably isn't one. No one gives an extra review. The payment error is not caught, and the benefits end up issued in the incorrect amount. When benefits get issued in the incorrect amount, if that issue is caught later, the household has to pay back any extra money that they got. And it doesn't matter whose fault it was. The household could have done everything right. It could have just been an honest mistake from the state agency that led to them getting more money than they were actually entitled to. The household still have to pay that money back. And for households who are applying for assistance purchasing food, to learn that in the coming months, your household budget just went down, you have less money to cover your expenses because now you need to pay back money that you received in the past, that can be really burdensome and really challenging. And so, even though it may seem at first glance like, oh, if you get extra money, maybe you're just lucky and you happen to get extra money, it can end up creating a lot of problems for the household because if it's caught later, they need to pay it back. If it's an underpayment, that also has a big effect on the household. If state agencies catch the underpayment and they raise the benefit levels to the correct amount, I think in general, households are pretty happy about that. So, kind of summarizing the participant perspective, really the outcomes that matter for households are the true positives and the false negatives. And you already saw earlier a model metric that incorporates those two numbers, it's sensitivity. Um, what this also means, though, and part of the reason that I think there's a lot of opportunity for predictive modeling being used in this way in Snap, is that the model metrics that come into conflict with sensitivity, which were the positive and negative predictive value, those model metrics involve numbers from the cases that really don't have a payment error, right? The real negatives. And households don't really have a lot of reason to be concerned about things that happen to the cases that don't have a payment error. So any measures of fairness, like looking to see if the positive and negative predictive values are the same for different groups of people, well, positive and predictive values, I think I would argue if I was a household applying, I wouldn't care about that very much. I just would be much more concerned about is the sensitivity for my type of household just as good as it is for other types of households? Because sensitivity is the thing that captures the results that actually make a difference for me as a household. For the state agency, it's a little bit different. From the state agency perspective, true positives, like That's the whole point of having a predictive model, right? You want the model to tell you this case is likely to have a payment error. You review it, and it turns out there was a payment error, and you fix it. So, more true positives you catch, the better. Mission accomplished. False negatives also matter to the state agency. If there are cases that really did have a payment error, but the model says it's fine, they are missing payment errors and they're going to end up issuing benefits in the incorrect amount. That's going to count against their payment error rate, and they may be stuck paying really large sums of money to keep the program running under the new rules in HR 1. So one of the results that didn't matter so much to the households, but definitely does matter to the state agency is false positives. False positives are the ones that don't actually have a payment error, but the model says there's something wrong with it. You should give it a second look. False positives basically represent wasted time for the state agency because someone is going to go give that case a second look only to find there was nothing wrong with it to begin with. So false positives are actually really critical for a state agency. A challenge for every single state agency is just staff being spread too thin. State agency staff work really hard and there are never enough hours in the day. And so if you have a model that is leading them to check a ton of cases that actually have nothing wrong with them, you're wasting a lot of time that they don't have. The last outcome from the state agency perspective, is something that doesn't really change their process very much, right? If there was no payment error on the case to begin with, and the model says there's no payment error, no one's going to give it a second look. It's going to be correct. So that number doesn't make a whole lot of difference to the state agency. So to summarize the state agency perspective, 3 of the 4 outcomes do have important effects on the state agency. And that means that state agencies need to look at more than just sensitivity, which captures the true positives and false negatives, and that's the one that mattered to households. The model metrics that are important for the state agency also need to incorporate something about false positives. So they might also look at the positive predictive value. They might also look at the specificity. There are a lot of other model metrics that they could consider as well. But one of the things I was hoping everyone would learn today is how can we think about predictive models and how to measure how well they work to make informed decisions about them. We've thought through which of the outcomes matter, and now we can make good decisions about how do we want to measure how well is it working for our purposes. So to kind of bring this all together and summarize some of this, states are under tremendous pressure right now to improve SNAP payment accuracy. And I think there's a lot of opportunity for predictive models to help state agencies identify the SNAP cases that are most likely to have payment errors. And something that is really nice in the SNAP context is that not only would this potentially improve payment accuracy, one of the key tensions when it comes to fairness in other applications of predictive models, like the whole compass debate, may not be quite so relevant in the SNAP payment accuracy prediction space. I will say, though, this is still hard. I don't mean to say, all right, problem solved, we're done here. Even if we can all agree about what matters for fairness in the context of SNAP, developing accurate models that are fair across all the protected classes is still going to be a challenge. But I think it's one well worth tackling because there's so much to be gained here by improving payment accuracy. And a little shameless self-promotion here. If you're interested in reading more about this, I was lucky enough to be part of a study that did sort of a landscape of how are SNAP state agency using risk assessment tools or predictive models, and a little bit of an intro or primer about how to use risk assessment or predictive modeling tools in SNAP to improve payment accuracy. So I want to leave you with a few closing thoughts. First, I want to make this a little broader than just, okay, this is about the legal system and this is about SNAP. This is actually about every domain of life. In public health, a lot of times we think about the social determinants of health, right? Predictive models are being used in every corner of the social determinants of health. In healthcare access and quality, predictive models are out there trying to find the folks who need early screening. So whether or not you get earlier screening may be a function in part of some predictive model somewhere. In neighborhood and the built environment, AI is being used a lot in housing. And so the housing market and how much houses cost has a whole lot of effect on where you can end up living. So absolutely, the neighborhoods and built environments that people experience that have effects on their health are being impacted by predictive models. In the social and community context, Allegheny County has one of the better known predictive models in the country, at least predictive models that are being used in a really high stakes decision making process. Allegheny County has been using predictive modelings to try to identify the children who most likely will need to be removed from their home in the future due to child abuse and neglect. So absolutely, really important decisions about the social and community context that kids are growing up in is being driven in part by predictive models. When it comes to economic stability, I'm sure a lot of folks on this call are well aware that AI is playing a bigger and bigger role in landing a job, right? There are predictive models that are running to try to help companies figure out which of these applicants are going to be the most effective at our company. And last but not least, in education, as you might guess, of course, there are predictive models there as well. An example there is trying to identify early who are the middle school students who are most likely to drop out of high school, and can we intervene early to improve their graduation rates? So I want to take us back to our learning objectives. What I'm hoping that you've learned at this point is a little bit about some potential pros and cons of using predictive analytics, right? They have a lot of power. It's really a valuable thing to know what's going to happen in the future, especially if we can know with a decent amount of accuracy. That's a major pro. But a con is that it raises some really serious and challenging questions about fairness. And that's something that we have to grapple with. The other learning objective was how can we evaluate predictive tools to make informed decisions about their use? What helped for me, and hopefully a helpful process for you, is to think about, all right, well, who stands to be helped or hurt by this model? And for all the possible outcomes, how would it affect those people? It may not always lead you to an easy answer, but I think that that's a good starting place to think about, should we be using a predictive tool in this context? And the very last thing that I want to leave you with is that, overall, I think it's a good question to ask, is this predictive model fair and effective? And that's most of what I've been talking to you about this whole time. It's just looking at these models, trying to measure how well they're working and asking if it's fair. I think a better question, though, is will the decisions made using this predictive model be more or less fair and effective than the decisions made in its absence? The world that we live in is not fair at baseline. And so adding in a predictive model on top of it isn't going to be the thing that tips the scale necessarily. And now it's unfair, whereas before it was perfectly fair. If we want to evaluate and really think through predictive models and their effects, I think we need to be comparing the two alternatives that we actually have. One option is we keep doing things the way we've been doing them, no predictive models, or we add a predictive model to the equation. I want to see the comparisons between those two things to help me make informed decisions about whether I want predictive models being used about things in my life and the people that I care about. Um, you might have noticed that it seemed like I kind of ducked the taking a side on that whole fairness debate earlier. Um, I will share what I think about it. When I was first taught about sensitivity and specificity and positive and negative predictive values in my intro epidemiology class, what our professor noted to us is that sensitivity and specificity are typically thought of as properties of your model, right? Like when we're thinking about a COVID test, the sensitivity, like how many of the people who really have COVID are going to get a positive result, that's a property of the test itself. Positive and negative predictive values, on the other hand, are properties and part of the context where you're using your model. Right? That whole example that I talked you through of testing the AI chatbot in the lab and then bringing it out into the community, and then the positive and negative predictive values changed a lot. That's because the percent of people in those populations who had COVID changed. Right? In the lab, it was 50-50. We had 100 people with COVID, 100 people without. Out in that community, it was 100 people with COVID, 1,000 people without. So because positive and negative predictive values are in part a property of the world as it is, the context where you're using your model, I think that you then need to ask, well, how fair is this little domain of the world as it is right now? And if a model that we're building reflects back to us the world that we're already living in, do we feel like that's a good measure of fairness? I would argue that in a lot of parts of our lives and domains of society, the world that we live in isn't very fair. And I personally would prefer the way that we measure how well the model is working and if it's fair to not be a property in part of the world we're living in. I want it to just be based on the model itself. Um, this is not a resolved debate. I'm sure there are a lot of folks out there who are working in this field who will disagree with me, and I absolutely recognize and see the validity in both sides of the argument here. And I hope you do too, right? When I was initially introducing to you sensitivity, specificity, positive and negative predictive values, how it really does feel like all of those things should be the same for everyone. And it feels very difficult to pick a side. Um, but that's my personal take on it. Although I'm sure as I continue to learn more, I'll continue to form and refine my thoughts. Okay. So with that, I really want to thank you so much for having me here. It's been an absolute pleasure and a tremendous privilege, and I'd love to take your questions.
Amazing. Thank you so much for that insightful talk. I certainly learned a lot, and I hope that my colleagues and everybody that was here with us did as well. And so I'm about to open it up to questions. Anybody I'll take questions first from my cohort, if anybody has them, and then from the general audience. But if has a question right now, I will ask one while my colleagues think of one. Um, a lot of us are doing research projects ourselves right now, and you touched on this a little bit, but after you ask yourself those two questions, like, is this fair? Is this going to benefit others? How do we know that a predictive model would be helpful in our research? Is it kind of trial and error, like we have to try one out, and if it's like, okay, this is not something that we can include in our research, or it's not beneficial, or it's not fair, yeah, how would you go about doing that for all of us who are working on research projects?
So this is the classic, I feel like, academic answer of like, well, it depends, which is such a cop out. But it really is a case by case thing. I think I mean, the debate being had about predictive modeling in the legal system is incredibly difficult. Like, that's a really tough question to answer. Um, in a way, I think it's a little bit lucky, for where I sit in my research, that I think the debate's a little easier in Snap, at least in a certain part of Snap. Um, but I don't know, do you have like a concrete example that we could think through of like, like in this topic, could a predictive model be helpful?
Yeah, I'm one of the research proposals that I'm doing right now is on how violence in social media can affect people's ability to feel empathy. And so, like,
Hmm.
could a, living in a different state affect like what they see, like how much violent media they see, or something like that? And how does that impact their ability to feel empathy for others?
So I know I'm not, deep into this area, but it's a really interesting research question, and in a lot of ways, I think you're asking a causal question, right? Does this exposure cause this outcome? And there's some pretty interesting applications of prediction modeling in causal inference. One of the really common study designs, at least in like kind of the policy domain, is called difference in differences. And so when you can't actually do an experiment to like, okay, we're gonna expose this group of people to this, that group of people to that, and see what happens, right? You're stuck with sort of observational data. And a lot of times in a policy context, right, if you want to know the effect of a policy, you can't randomly assign a new SNAP policy to this group of people versus that group of people. What you can do is see, all right, over time, here's what happened to a state without the policy. Here's what happened to a state with the policy to get a sense of, all right, are there differences here and try to draw some causal inference. And so, as part of that, like general concept, what you want to understand is the state that actually did adopt that policy, what would have happened to them had they not adopted that policy. And the difference between what would have happened and what actually did happen is like your causal effect. Well, if you're interested in knowing what would have happened in the future, that's what predictive models do for you, right? Like, and so while I can't think of a really specific application of predictive modeling for that type of question, um, there are a lot of ways that, uh, but basically any domain where you want to know what would have happened or what will happen, that's probably a spot where a good and fair predictive model would be helpful to you.
Amazing. Thank you. Abba, go ahead.
Thanks, Kiana. And thank you so much, Dr. Beckerman-Hsu, for your coming to speak with us today. So I was really like towards the end of your presentation when you brought up students like using this on like students and their experiences. I kind of want to like I guess echo what how Kiana asked her question, but like for one of my research proposals, I was looking into whether chronic illness or like repetitive like health conditions being having an impact on academic engagement, as particularly in Mississippi public schools. So I'm from the state of Mississippi, and so like I had planned on like in my proposal, I'd said that I would look at 4 different regions of Mississippi, and like they're all based on different like socioeconomic like factors. Like that's why I picked 4 regions. But if you were to if we were to use this kind of framework, would it be useful and would it is I guess my question is kind of like can predictive modeling be used on like kids or like on younger populations because so much of like kids change, I guess. Like I don't know, that's like a really weird way of asking it.
I think no, I think I understand what you're saying. And actually, I'm currently sitting in a hotel in Macomb, Mississippi,
Oh,
traveling for a
awesome.
project.
Cool.
Um,
Yeah.
so there's how I think in part what you're asking is like how good could your prediction possibly be if you're talking about kids? Because kids change a lot. Um, I'm going to give you another it depends, but a little more specific. It depends on how good your data are. If you
Okay.
have really good data on a lot of details about, kids ages 0 through 5, then maybe you could make some like pretty accurate predictions about what's going to happen to them when they enter kindergarten or first grade. Um, if you don't have good quality data, probably not. And there are some things where, yeah, I mean, there's certain things that you just can't predict very well. If I'm sure there are about 1 million people out there trying to build super sophisticated predictive models for like the stock market and things like that, right? Where, there's a lot of money to be made. I think the stock market famously is a pretty hard thing to predict. Um, and so that's not a complete answer to your question. Like, is it I mean, and actually, I'll be honest, I did not look up the accuracy of that. It was a Planet, not a Planet Money. I saw the comment about that Planet Money story about Snap. It's a great one, actually. If anyone hasn't listened to it, and you want to get up quickly to speed about what's going on with Snap and HR1, it's really good. Um, it was in another NPR show about predictive modeling for which middle school students are likely to drop out. I'd be curious to look at how accurate those are in general. I know that that's a pretty common use of predictive models in education. There are probably some good review papers for you there, that looks across various predictive models that have been used in different places. How accurate are they?
Cool. Yeah. Thank you so much.
Awesome. Thank you so much. Sasha, if you would like to read the question that you wrote in the chat.
Yeah, of course. Hi, Dr. Beckerman-Hsu. I also really appreciated hearing your lecture. This is definitely a topic that I haven't had much of an introduction to, so it was just so interesting to hear your perspective on everything. And I know you kind of mentioned this a little bit at the end, with kind of the broader social determinants of health and how there's current programs that utilize the predictive models. But kind of with your discussion about the SNAP payment accuracy and the impact of the predictive models, particularly particularly with HR1 and the worsening of the situation for already disadvantaged communities in this country. Are there any other programs or initiatives within the public health realm that currently don't utilize those predictive models accurately, or even utilize them but not necessarily in a fair and effective way?
That is a great question, and I do not have enough subject matter expertise over all of the programs to give you a really good answer. Um, a starting point to that answer is if you're interested in specifically this topic of payment accuracy, that's not a SNAP specific thing. You can go to paymentaccuracy.gov. Under law, the Payment Integrity Information Act, PIIA, um, federal programs at a certain level of spending and that meet certain conditions have to measure and report their payment accuracy. So you can go to paymentaccuracy.gov and see those statistics for a whole suite of different programs. I don't know well enough how many of those programs are already using predictive models. A lot of federal programs are state administered, so the decision to use one of these models or not often is not a federal decision. So one state may be using it, another state may not. Um, but for the same reasons that predictive modeling, I think, can be valuable in SNAP, there are a lot of other programs that do serve low-income households, folks with disabilities, older adults. Um, that payment accuracy is a priority for them too. Uh, and if they're not already implementing some of this modeling, it could be helpful.
Thank you so much.
Amazing, thank you. And I'm not seeing any more questions in the chat, but I will ask one more while we're kind of thinking of some more. But to kind of piggyback off of what Sasha just asked, and I know you kind of touched on this a bit at the end, but if you had to choose kind of one place other than SNAP, where do you think predictive models will be most effective and accurate in helping
Mhm.
the health outcomes of Americans?
That's a good question. You know, I part of like always, top of mind when I think about things, I always think about education. I was a public school teacher before I started in public health. And yeah, I mean, so much of our, life opportunities and chances are driven by education. And so, who's going to drop out early is certainly important to know. Where I was teaching high school science in Los Angeles, in high needs schools, and something that stood out to me personally was that rightfully so, a lot of time and energy went to helping to catch kids up. There are a lot of kids who are really, really far behind. I had, just to give you, an example, like I had a girl in my AP biology class, 12th grade, like sweetest kid, did all her work, great student, she had a fifth grade reading level. And so absolutely, identifying kids who are falling behind, kids who aren't quite where, you would hope they are is I think a valuable focus. But what I also noticed is because so much time and energy was going into trying to bring kids up to grade level, and that was the bulk of the kids, the super bright kids who were way ahead, it's like, well, they're fine, and so like very little energy was dedicated to them to help them maximize their potential. Um, that is a very tough question of what's the right way to distribute a school's resources across all the students. And the right way to do things you're not going to get an answer out of a predictive model for that. But where I'm going with this is identifying the kids from an early age who could benefit from advanced classes, an honors class or something like that. Uh, One that sticks out to me is just hearing a radio story about how a lot of times students coming from who speak English as a second language are unlikely to be identified as, to be good fits for honors and AP classes. it's just their English skills. It's not their academic ability, it's just their English skills. And so it makes sense. Like I would overlook those kids too when I was a teacher. I would have no way of identifying them. But if we had a better way to spot those kids and place them in an environment that would help them to, have curriculum that's the right fit for them and maximize their potential, um, I think that'd be cool too. There's so many kids who I care a lot about, and I think it would have been great for them to, you know, had a few more opportunities than they did.
Yeah, that's so good. Thank you so much. And if there are no other questions, oh, yes. Uh, John Partridge, go ahead.
Dr. Beckerman, good to see you again. What are some of the variables that contribute to the different states' rates that, there did seem to be quite a wide spread in the percent that you displayed on that United States map and the color coding. What are some of the variables that contribute to those different rates?
Yeah, that's a good question. Um, There are a lot of variables.
Mhm.
A couple top of mind. So part of the SNAP funding model, and actually something else that's changing under HR1. In the past, the administrative cost of SNAP, so like paying the workers and all that work that goes into actually administering the program, was split 50-50 state federal. And so, some states in this country just have uh, you know, more support for public programs and are willing to pay more money into that. And so, the kind of cost per case processed in SNAP varies a lot across the country. I think part of that is a function of how the states do their work, but also I think part of it's a function of the funding that they have available. Um, One of the changes under HR1 is that the funding is gonna be shifting to 75% state, 25% federal. So even for the state agencies that don't have to pay any of the food benefits, they're going to be taking on more of the cost of running the program. Other factors, there are a lot of policy options, essentially like how to get things done. Do you want yet another change under HR1 is work requirements. Keeping track of work requirements is a lot to keep track of. It's easy to make mistakes. In the past, there have been waivers that states can apply for that essentially demonstrated if the unemployment rate in their state or in a certain area is at a certain level. I think the logic is like, look, like it's not reasonable to ask everyone to be employed. Like plenty of people, snap or no, are having trouble finding jobs. And so some of the, elements related to work could be waived. Some of that's going away. And so yeah, I think that's kind of the gist of it. It's sort of a combination of policies that states choose, the way that they run their program, the funding they have available.
Awesome, thank you. And if we do not have any more questions, then I think Dr. Oh, yeah.
Yeah, Jake, thanks so much for this talk today. It's great to hear someone speaking on a fairly technical question on a level that, we can all understand and appreciate, the work that you do or things that you think about. So after you're done with my question, it'll go back to Kiona, who will close it out. But meanwhile, um, I'd like to ask a sort of a career question. Our students are
Mhm.
coming up to graduation, most of them at the end of the summer, some of them a little bit after that. And, there's been like, seismic changes in the public health world and global
Yeah.
health world over the last couple of years. And I'm sure presented a lot of difficulties and perhaps some opportunities, but certainly shifts in things that a graduating student might think about in terms of directions to go in particular sub areas of public health or advocacy, as well as perhaps continuing their education in the manner that you did. So, you have any comments along those lines?
Hmm. Yeah. I frequently say that my wife, who I met in grad school, was the smarter of the two of us to just go get a job after a master's. Um, and I know I can definitely relate to like being graduate school. Like all of the people, a lot of the people around you who are doing super cool work are your professors who all have PhDs. And I definitely had the idea of like, yeah, I want to do that. And I also like teaching. I had a thought too that I wanted to teach, and so for me that was the right choice. I think it's really worth thinking like look at the jobs available to you though. Like more education isn't necessarily better. There's so much cool work to be done out there. Places that I did look when I was searching for jobs, and I would look now if I were searching for new jobs. State and local government. There that's a lot of where the rubber meets the road of actually, you know, creating the environments and systems that affect, the public's health. Um, I have the, real privilege, honestly, of getting to work with a lot of folks in state and local government. There are a lot of super smart, passionate, dedicated people. And so I would absolutely be looking there. I know, yeah, federal research funding, the federal research funding environment is very challenging right now. There are a lot of nonprofits and philanthropic organizations that are doing a lot of good work in the public health space, and so that's another good place to look. Um, I'll, come, shoot me a message on LinkedIn. I'm happy to help however I can. I know it's, you know, not for any of you, all of you are going to have a Georgetown degree on your resume, but for some other people, like the job market is kind of tough right now. And so if I can help, I'm happy to do it.
Great. And we talked briefly about possible internships that you might know about. So
Yeah,
students feel free to reach out with an email. Dr. Beckerman's a very busy person, I've learned, so, but he will get back to you. Okay, so we'll go back to Kiona. Thanks again, Jake. It's been great. And I'll send you an email about some thoughts I have about some of this, but talk to you later.
great. Thank you so much for having me. It's such a pleasure to see so many of the folks who put up with me when I was 20 and wreaking havoc in their labs, but who taught me so much. So Adam and Jose and John and so many others. Thank you so much.
Yeah, and Jose sent me a DM here that asked me to convey his congratulations, and he had to leave for a meeting at his university. So, okay, Kiona.
Thank you so much, Dr. Beckerman-Hsu, and thank you for everyone who attended our final seminar of the semester. Hope you have amazing days.
Good